Good morning. My name is Bharti Nathani and I'm a practical nursing Durham College student, semester 2. This is my ID card and we are doing the critique for final critique of medicine administration. Before administering any kind of a medicine, we should have the drug knowledge, which I have it right here. We are going to administer acetaminophen. So the acetaminophen, drug knowledge we should have about the drug name, classification, onset, peak, duration, contraindication, side effects, and health teaching. We do it at bedside. Now for acetaminophen, I see here that it can be given orally, rectally, by IV. Under classification, it says antipyretic, non-opioid analgesic. So that means it is used for the treatment of mild pain and fever. And under route, I see that when given orally, PO, onset 0.5 to 1 hour, peak 1 to 3 hours, and duration 3 to 8 hours. If given rectally, 0.5 to 1 hour is the onset, peak 1 to 3 hours, and duration 3 to 4 hours. Now under contraindications, it says that should be avoided in the patient with hypersensitivity and in those who have a severe hepatic impairment or acute liver disease. Now also see that there are not much side effects, but under gastrointestinal, hepatotoxicity if given in larger doses, constipation, increased liver enzymes, and nausea. Now I also see when under the nursing implications that prolonged use of acetaminophen increases the risk of adverse renal effects. Now when we are doing the family teaching, I'll make sure that so it says that chronic use of more than 4 grams per day leads to hepatotoxicity, renal or cardiac damage, and will notify or inform the patient that any rash or anything occurs, he has to let the professional healthcare provider know. And especially in the diabetic patients, that acetaminophen may alter the blood glucose monitoring. So advise patient if any changes, he can always let the healthcare provider know. Once we are done with the drug knowledge, I'm just going to leave it aside. And we should also go through the medication administration policy. So every agency have a medicine administration policy. We'll go through this. And once we are done going through this, I will check patient's chart. And I will open the chart and do the signature and the sign-in sheet with today's date, August the 6th, 2020. My name, Bharti Nathani. Status SPN1, my signature, and my initials. So once we are done filling the sign-in sheet, I am going to take out doctor's order and MAR sheet. So we always verify doctor's order and MAR sheet. So I do see here that this is for patient Sid Garland, medical record MRN number 344316, 344316. And a date of birth is 8th of November 1965, 8th of November 1965. Allergies penicillin and codeine, allergies penicillin and codeine. So we verified patient's name. Now we'll see about the drug. So I see acetaminophen 650 milligram ordered. So acetaminophen 650 milligram, 650 milligram. Route PO or PR, route PO or PR. Frequency every 6 hours. Frequency every 6 hours, and under special instructions, do not exceed 4 grams per day, not to exceed 4 grams per day for 4 days only, for 4 days. Now I also see in the MAR that under the time 0600 hours, 12 hours, 1800 hours, and midnight. Today's date, August 6, 2020, and it's 0600 hours now, and the medicine has not been administered. And once I have verified this information, I will write my name in MAR, verified by name. So we verified patient's identity, drug, dose, everything. So once I'm done with this, I'll put doctor's order away. And now we'll check patient's chart. So we always check patient's chart to verify patient's medication history, his past history, or anything that is contraindicating and stopping us from giving this kind of medication. any kind of allergies, and yeah, so we'll just go through that. And I will leave this back. Okay, so I have the worksheet also along with me, so I can enter the details right here so we can identify the patient later. So I see that this is for Sid Garland. And date of birth is November the 8th, 1965. Allergies penicillin and codeine. MRN number is 344316, and I see that in the case history that patient Mr. Sid Garland is 2 days post-operative. He just had his below knee amputation of his left leg, and under past medical history, type 2 diabetes, myocardial infarction, peripheral neuropathy, coronary artery disease, asthma and hypertension. So I'll enter all the details here, relevant details here, so that can be helpful to us to identify the patient. Once we have done this, I'm just going to put the chart back, and I'll carry this worksheet in my pocket so we can use it to identify the patient later. So now I also pre-assessed patient earlier, and patient was stable. So we did check patient's vital signs, pain score, and his ability to swallow. He was able to swallow properly. His pain score was 4 to 5, which is mild to moderate post-operative pain. So that's the reason we are giving this medication. So we already pre-assessed patient. Now the next step, I'm going to do hand hygiene. And once we are done with the hand hygiene, we will select the correct drug from the drawer. So I do see that we select acetaminophen, MR, so correct medicine selected. Now I check the expiry date, August 2025, so good to use. Okay, so now we will start with our first check, MAR to medicine container. So this is for Sid Garland, MRN number 344316, date of birth 8th November 1965, allergies penicillin and codeine, and now under the drug, so right patient. Now acetaminophen, dose is 650 milligram. We have 325 milligram. We'll calculate the dose. We'll do the math here. Route is PO or PR. These are in the tablet forms. We will be giving it PO. We already assessed patient's ability to swallow. We can give this by PO. And the site will be by mouth. Frequency every 6 hours. And the time 0600 hours now. Today's date August 6, 2020. The medicine has not been administered, so we'll be giving it now. And the reason is for post-operative mild to moderate pain. So once I am done with my first check, we will start with the second check. We'll do the same thing, MAR to medicine container. So Sid Garland, MRN number 344316, date of birth 8th November 1965, allergies penicillin and codeine, and now the drug acetaminophen, dose is 650 milligram. We have 325 milligram available here. We'll do the math, we'll calculate the dose. Route PO or PR. These are in the tablet forms. We will give the patient PO orally. We already assessed patient's ability to swallow, so it was good to give. And site by mouth. Frequency every 6 hours. And time at 0600 hours now. Today's date August 6, 2020. It's not been given, so we can give it now. And reason is for mild to moderate post-operative pain. So once I'm done with my second check, I will calculate the math, calculate the dose. So now the formula is desired dose upon available dose times quantity. So the dose order is 650 milligram. The one we have available is 325 milligram times 1 tablet. I'll use the math. 650 divided by 325 times 1, so which is 2 tablets. We'll do the box and I will show the box. So once I calculated my dose, I will pour the medication without touching. Okay, so this is 2 medications and I'll pour it in the cup. And then we'll close the medicine. So I'll pour 2 medications. Now we will do the same way our third check, which will be same thing, MAR to medicine container. This is for Sidgarlen, MRN number 344316, 344316, date of birth 8 November 1965, 8th of November 1965, and allergies penicillin codeine, drug acetaminophen, dose ordered is 650 milligram. The one we have is 325 milligram, and route is PO or PR. PO, or these are in the tablet forms. We'll be giving it PO. We already assessed patient's ability to swallow, so it was good. Site will be by mouth. Frequency every 6 hours. And time 0600 hours. Today's date August 6, 2020. 0600 hours. Today's date August 6, 2020. I don't see the medication given, so we'll be giving it now. And the reason is for mild to moderate post-operative pain. So once I'm done with my third check, we will again do the math. So the formula, desired dose upon available dose times quantity is equal to, so ordered dose is 650 milligram. The one we have available is 325 milligram times 1 tablet is equal to, so we'll do 650 25 times 1, so that is 2 tablets. And I already poured the 2 medicine. So what I'm gonna do is I'm going to call my teacher. She'll come and check. Once she says that everything is okay, then I will just leave this MAR back and the container, just tidy up the table here. Now before entering the patient's room, we'll be again do the hand hygiene. Okay, so hand hygiene, take the medicine and a cup of water and we'll go to patient's room. Hello, good morning, Mr. Garland. My name is Bharti and I'm a practical nursing Durham College student. How are you doing today? Okay, so I'm here to give you the post mild to moderate pain medication here. So before we start, I'll just check verified information. Can I have your last name and first name, please? Sid Garland. Date of birth, please. November 8, 1965. November 8, 1965. Okay, do you have any kind of allergies? Penicillin and codeine. I'll also verify the information with the armband. Sid Garland. Date of birth 8 November 1965. 8th of November 1965. MRN 344316. 344316. Allergies penicillin and codeine. Perfect. So yes, I have the right patient. Okay, Mr. Garland. I will do the quick environment check. I will make sure the bed is in the lowest position. Bed bricks are engaged and side rails as per the care plan. Oxygen suction working and call bell within patient's reach. So after the quick environment check, so I'll ask patient. So you have allergies, right? What kind of allergies? Penicillin and codeine. Can you tell me more about it? What happens if you take penicillin and codeine? So patient will tell me rash or itchiness. We'll just make sure we take this information just to make sure that if there is anything contraindicating or stopping us from giving this medication. So everything looks okay. I'll make patient sit up in the high collar's position and give the health teaching. Okay, Mr. Garland, So this is the medication, pain medication. Always have with full cup of water, so it increases the absorption and effectiveness of this medicine, and to avoid any side effects like constipation. And since you are a diabetic patient, so this medication sometimes alter the blood glucose monitoring levels. So if you not feel any change, please notify or press the call bell and we'll be here. And if you also develop any kind of rash or any itchiness, just press the call bell and we'll be here for your help, okay? So once I'm done with the health teaching, I'll get this medicine with the full cup of water and watch patient take it. And once he has taken the medicine, I'll ask patient, how did it go? Did he swallow the pills? And watch him that he has swallowed the pills and everything is okay. Once this is done, I'll make sure that the bed is in the original position and leave the patient in the safe, comfortable position, and will notify the patient that I'll be back in 30 minutes to do the assessment. If you need anything, please press the call back, okay? So once I'm done, I'll just leave the room, again do the hand hygiene after coming out of patient's room, and now we'll do the documentation. So when I'm doing the documentation, we will write today's date, which is August the 6th, 2020, my initials and route. We have given it orally. And now I will ask my supervisor or teacher to come and see, check, and once she is signing, once this is done, after 30 minutes I'll go and do the post assessment to make sure that the pain and check pain score level if patient is feeling better, and check side effects or any contraindications of the drug. And once I'm done, yeah, so thank you.